Together for a healthier future. This is a goal that has brought together health and tourism officials from over 20 Muslim countries in Tehran on Tuesday. The three-day event seeks to boost the level of cooperation among Muslim states in the health sector.
In this event, health and tourism officials of Iran and other Muslim countries have the chance to network and explore the potentials for investment. It is also a chance for Iran to present its capacities to other countries.
Since 2017, the country's health tourism has witnessed a sudden boost, with the number of tourists seeking medication in Iran more than doubling. The number has now reached over 300,000 visitors each year. The reason has to do with the fall in Iran's national currency against the US dollar, which has acted as a blessing in disguise and made medication prices in Iran unrivaled, given the high-quality services Iranian clinics offer to foreign patients.
Iran's medication prices are at least 30% less than other countries. Coupled with the diversity and quality of the medical services in Iran, the country is the best target in the region for health tourists.
Now, this has also made Iran a strong rival for the tourist magnet and Iran's next-door neighbor, Turkey.
There are a lot of possibility. Thousands and thousands of people want to discover Tehran, want to discover Iran, want to discover the culture.
Last year, Iran made over $1 billion in revenue from its health tourism. That's 10% of the country's total income from the tourism sector. These figures promise a bright future for the country's tourism, and officials hope that it can be a viable alternative for the fluctuating oil revenues. The oil industry has been the sole engine spinning the wheels of Iran's economy for more than half a century. Given the vulnerability of oil prices to political and economic developments, Iran is in an all-out effort to find a replacement for petromoney. Experts believe health tourism is the answer to this problem.
Regarding Iran's difficulties in money transfer and banking transactions, reliance on oil revenues is not logical. Health tourism is the best alternative. We are currently making some $1 billion out of health tourism. This is why, with the existing potentials, Iran can make over $7 billion.
To get to this figure, Iran is working to improve the required infrastructure. In this event, Iranian health officials will sign MOUs with countries such as Serbia, Oman, Iraq and Turkey to facilitate visa issuance to health tourists as the first step toward a tourism-based economy. Yusuf Jalali, Pros TV, Tehran.